Hi, everyone. My name is Michelle Curtis, and I want to welcome you all to the Aging Services Spotlight on HCBS webinar series. As part of the series that has been created to promote available home and community-based services, today we are discussing the Aging and Disability Resource Link, the ADRL, which will be presented by Jackie Seefeld. I've muted all microphones and cameras have been turned off for the duration of the webinar. However, we will leave some time at the end for any questions that can be dropped into the meeting chat. Jackie, I'll turn it over to you.
Okay, welcome everybody, and I appreciate you taking part of your lunch to listen in regards to the ADRL. And so, like Shelley said, we will go through this brief presentation, and then at the end, there's a opportunity for you guys to ask questions. And if you don't feel comfortable asking questions, you can always shoot us an email after the presentation. So the North Dakota Aging and Disability Resource Link, you can see on the front page here, is the phone number. And that is one of the entry points to get into aging services. And there's a few more that we'll go over in a little bit more detail here. So a little bit of background on the ADRL. So Aging Services has had it since 2012 in the Department of Human Services, and we've always administered it. But in the 2019 legislative session, Aging Services received some state general funds to make the ADRL more robust. And with those funds, we were allowed to hire some full-time staff to just fulfill that position, create a single point of entry for the home and community-based services, and then creating awareness not only about the ADRL, but also about aging services as a whole. So you might ask yourself, what is the ADRL? Well, the ADRL does provide information and referral assistance to services that might be available statewide. Sometimes we do get calls that come in from other states looking for our services as well. Connect those individuals to those services that really want to remain in their homes or in their communities. And then once again, the centralized intake for home and community-based services is really to create that no wrong door approach. And according to the Administration for Community Living, the No Wrong Door is a one-stop coordinated system, not just to one entity, but a network, a single standard process, so common protocols and information exchange, objective and neutral, so impartial and unbiased, and it really wants to be person-centered, so focusing on what you want and not what the system wants. Seamless and person-friendly, so really making sure that the individuals that are answering our phones have that friendly communication back and forth. And then the use of private and public programs, so streamline access to long-term supports and services. So even if somebody is very wealthy and just wants to private pay for all those services, we also help those individuals as well. Okay, so you might ask yourself once again, who can utilize the ADRL? Once again, anybody can call the ADRL. These are just a few examples, but older adults themselves, they can call. Individuals with physical disabilities, their caregivers, their family, their friends, their neighbors, health professionals, etc. There is no cost to calling the ADRL, but please note that some of our services do have a fee to them, so they're not always free. With the centralized intake, so once you call into Aging Services and that centralized intake, it is staffed with 6 intake specialists. And those intake specialists are here to gather and assess and gather the information and then really provide the information and education and then the appropriate referrals. So whether it goes to our case managers, whether it goes to our community service coordinators, or even outside organizations and partners. And sometimes they answer the questions themselves. They can find all the information that that individual is looking for and doesn't want to be referred on because we were able to answer their questions right off the bat. So this is just a few of the programs and the funding sources that we work with. I'm not going to go over them all in whole, but just kind of the big ones that people call in for. So with the home and community-based services, there is criteria. So if you've ever had the opportunity to call in and we're wondering about home and community-based services, you've probably been asked a lot of questions, and those questions were developed with the case managers to make sure that they are receiving appropriate referrals. So those calls can take anywhere from a half hour, they've taken up to 2 hours, just depending upon what the situation, the individual, And if they have all the information handy, sometimes it's multiple calls before we can refer that individual on. But please note that once everything has been completed, that referral is done instantaneously to that individual. So their assets do have to be under 50,000. It is income based. There is some income based limit, so there is a sliding fee scale. And once again, those are the ones that are going to have some fees attached to them. If the individual has recipient liability, once again, those are some fees that they would have to pay as well. They need to meet the functional criteria, and once again, each program is different, and I'm not going to go into detail in the programs. They must have a physical disability. Individuals that are provided services under other programs could potentially still receive our services, but they cannot be duplicated. So that's the big key word is. Individuals that are eligible for DD programs are unable to stop those services and strictly move to us. We have been receiving a lot of phone calls just recently in regards to individuals' parents wanting to be that paid caregiver that are receiving DD services. And unfortunately, that's not an option through us. And then our other field staff are the community service coordinators. So they do a lot with the options counseling. And so options counseling, we've kind of changed a little bit in the sense of it doesn't matter where the individual resides, whether it's in the long-term care facility, whether it's in their home, sometimes it might be a homeless shelter, depending upon their situation. And then once again, they're just providing resources and connections, and sometimes it's helping fill out that paperwork. There's lots of different ways that those individuals are helping those individuals that have called into us. And then we have the Family Caregiver Support Program. That is a pretty well program out there. And these are really for those 24-hour caretakers that are just need a break. And once again, that break can be any what they choose to do. So it might be going shopping, it might be taking a nap, whatever they choose to do with their time is up to them. Now there is criteria for the Family Caregiver Support Program, but once again, our ADRL intake specialist would kind of go over just a brief bit of it, but then those community service coordinators will come out and meet with the families and then fill out the additional paperwork that is required. And then we do have the companionship program. That's kind of like a little hidden secret at this point. With the companionship, this doesn't have any financial attachments. So we did get this a little bit more robust when we received some COVID relief funds. And with that program, it's individuals that are just looking for someone to visit with, to stop that social isolation that they might be experiencing. Maybe it's someone to take them to church with them. Many different things, and it doesn't look at financials. And then once again, we do have those skilled care referrals that come from the, that are for the long-term supports and services. And once again, that kind of falls under that options counseling. So additional referrals, and once again, these are just a few. We do multiple, but these are just a few of them. We do to North Dakota Assistive Safety, the Alzheimer's Association, DD Division, mental health services, so either the human service centers or the zones who are taking care of the 1915I, economic assistance, housing assistance, the coordinators, MFP, ADRL transitions, which is housed under aging, but Jake does handle all of those. And then the VAPS program, which Michelle has her staff that does the intake, but sometimes they do come through us and we don't deter them away. We help with that and then make sure that the intake gets to the right individuals. And then also the guardianship assistant programs. Once again, that falls under Michelle. And then these, once again, are some of the federally funded, it's the state and federally funded sources. So as you can see, some of those programs that we just talked about are listed under there. So the Family Caregiver, the Vulnerable Adults, the Ombudsman Program, so forth like that are under the Older Americans Act. The nice benefit with that is there's no financial criteria for those. But you do have to be 60 and over to get those. We do have a lot of contracts out for our services that fall under the Older Americans Act. So like the nutrition health, the falls prevention, telecommunications, the assistive safety, legal services, just a few. And then like I said, we do have the money falls a person. And then also with COVID, we did get some relief funds, which we created the ADRL transitions. And then the home and community-based services. And under their programs, they have the med waiver, the state plan, and then SPED and expanded SPED. And some of their services that they offer are adult daycare, foster care, residential care, chore service, companionship, emergency response, extended personal care, homemaker, which I would say might be one of the top ones, and then personal care services, just to name a few. So as you can see with the ADRL, prior to us hiring those intake specialists and really promoting the ADRL, you can see back in 2020 of September, we only received like around 169 calls that month. And then you can see as it progressed, when all those calls started coming to that one single point of entry. And obviously there's some dips, and the reason for those dips is because other people are accessing aging services through the other methods that we'll talk about, not just through the phones. So this is a little video that I'm going to show you. With those funds, we were able to create some promotional material. It has been out there once, and we are going to be putting it back out there again just to create that awareness. Please note that all these people that are in this video are from North Dakota and do receive our services. And so I'm going to hit play here.
With help, I can live independently at home. I really like that I have choices.
Having support allows me to be a better caregiver.
When you know your options for care, you can choose what's right for you. Aging and Disability Resource Link staff are here to assist individuals, families, professionals, and caregivers. We help find services and supports in home and in the community to maintain or improve your quality of life.
With help.
Okay. And then this is our website. If you've ever gone out there, it's a pretty handy tool. And like I said, that's where the fluctuation of calls come in. And some people are accessing this more frequent as well. With this website, you can see in the upper right, we have what's highlighted right now is the home, and then there's the caregiver support services, and those all have drop-down boxes. So you can actually search for your own service if you wanted to in your county. You can just put in one word and it would bring up all those services that are available statewide. And one thing is that we do promote everybody that's wanting to be on our database. There is some paperwork that we have that we send out and have them fill it out because we want to market them the way they want to be marketed. And then we do quarterly updates with all of those individuals on our database to make sure the information is still correct. And so if you know of anybody or you're not out there and you want to be out there for advertising, please reach out to us. We're more than happy to get you on our database. And then once again, you got the quick links, the contact us, and then under the assessment form, you can see that there's a little blue triangle for a drop-down box. That would show you the home and community-based intake, the big form that we would fill out where those calls are the ones that take 30 minutes plus. But you can just get a general idea of what kind of questions they're going to ask the individuals, or if you're just curious and want to know yourself. We do have the skilled facility referral out there, so the SFM 584. And then we also have another option of how you can get to apply for the web intake, this home and community-based services. So you can see in the middle of the page, it's the Aging and Disability Resource link. It has our phone number, contact us. But right below that is the home and community-based services and apply now. If you were to click on that, that would bring you to a web intake. And that web intake is not as intense as the other one, but there are some required questions that you have to fill out before you can submit it. If you don't fill it out, it won't let you submit, and we'll let you know what the error is. Once you do submit, you will get a response back that says it was successfully and that we have 3 business days to reach back out to you. Now in that web intake too, you can put in there whether you want us to reach out to you or the individual that you're referring. So just make sure that is clearly noted in there, and then all the contact information. But that comes right into our WellSky database. So once it's submitted, it's automatically in aging services. And then this is just, once again, other ways. So how do you want, if individuals want to apply or get more information about us, where would they go? Once again, they can call the 855 number, the 462-5465. They can email us through carechoice@nd.gov. And once again, you should get an auto response that it was successfully submitted. And then also through the website that I just showed you. And then there is Relay North Dakota. So those are the options. And then that is the end of my presentation. So if you guys have any questions, I'm more than happy to answer them. Don't be shy. No question in my mind is a dumb question, and somebody else might be thinking that. So I will let it go back to Shelly so she can let me know if there's any questions.
Hi, Jackie. Would you mind sharing? I have some feedback. Sharing your contact information for the people on the telephone,
Like emailing it out?
or just saying it verbally?
Oh, just verbally saying it? Yep, yep. So my email address, if you wanted to email me, is JJ, and then it's Seafelt. It's S like in Sam, EE, F like in Frank, EL, D like in dog, T like in Tom, at nd.gov. And then my direct line is 701-328-4645. And then once again, if you didn't catch all of that, I'm more than willing to repeat it, but you can also call ADRL, you can email Care Choice, and they can also send me the email directly to me, and I'm more than happy to reach out that way as well.
And for those on the phone, Jackie has again shared the contact information. The 800 number for the ADRL is 1-855-462-5465. And that email address is carechoice@nd.gov. And the website is carechoice.nd.assistguide.net. Okay, we have a question here from Brenda. She is saying that I have a resident that needs a guardian.
Brenda, you can call into the ADRL and we can get you directly to Michelle Gayette. And she is our guardianship expertise, and she can tell you everything that you would need to know in regards to all of that. And there is some financial support for those individuals as well.
Okay, so Brenda, it looks like that answered your question. Wonderful. I have another question from Jordan. For assets of $50,000, does that include equity on their personal home, or are we looking at liquidity?
I'm not the best expert in that, but yes, we would look at all of their assets, so their equity into their home, if they have any rental property, they own land, so forth like that.
Okay, a couple of great questions. Does anyone else have anything?
What if somebody's far away, like not in a central location like Bismarck, but further out, a rural area?
That is looking for services or
Anything. Yeah. I mean, it's hard to get people to cover those rural areas.
Yep. So once again, call into our aging services line or email or go to the website and do a web intake. But once again, we look at the services statewide. So it's not just looking at Fargo, Bismarck, Minot, Grand Forks, so forth like that. But we want to find all the resources that might be available in those rural areas. Is there everything? Probably not, but we want to provide the best we can. And so we do have, once again, if we might not be covering everything and that person still wants an in-person visit, depending upon the situation, we can either refer to the case managers or the community service coordinators that might have a different resource that we didn't offer.
Okay. Because I'm just going to give you an example. I got hurt like 2 weeks ago, and now I'm in a wheelchair. And there's no one to help.
You cut out at the end there. I'm sorry.
I said, well, I'm in a wheelchair basically right now, and until my leg gets better, and there's like no one in Linton to help.
Yeah, that I will say is a struggle area, but once again, I would definitely just reach out. Once again, we try to research everything, so we will do our best to help you, but please just reach out.
Okay, I will. Thanks.
You're welcome. And then there is another question, does the ADRL serve hire? Yep, like I stated before, we will work with anybody that, no matter what their financial level is. So if it's an individual that doesn't qualify for our state or federally funded programs, we still work with them. And then they would just have to private pay for their services, but we still help them find those resources, connect them to those individuals. Once again, if there's any paperwork that needs to fill out, we definitely will help them. And then like Kaylee said, I'm sure she sees a lot of it, but Home and Community Base has been actively trying to recruit and incentivize for those rural areas too. So we're just really hoping to enroll more providers. And then once again, if you know of anybody, don't hesitate to refer them. It is a great opportunity. Anybody that's 18 and older can do it. There is some courses. They can actually get a college degree off of it if they choose to, but there's a lot of opportunity out there. Will the webinar be archived? I believe so, right, Shelley?
Yes. And we do still have a few minutes left if anybody has any other questions, or Jackie, if you have anything else you want to add.
Not that I can think of, but they've all been great questions. Once again, I just don't want anybody to ever be hesitant to call us. We're here for you, and we want to help as many people as we can. We might not always have the answers available when you call, but we'll definitely research and then call back. And I guess the other big thing is if somebody is referred to us, by, like, let's say a health professional or a neighbor, so forth like that, because of the scams, a lot of people are told, don't answer your phone if you don't know the number, which I'm one of those people. If I don't know your number, I'm not going to answer it. But so a lot of people will not answer our phone calls when we do try to call them back, which is very difficult at times. We do leave messages, so hopefully they feel that it's safe enough to call back. But if we do get a hold of somebody and they do need to call us back, we really try to promote what number is going to show up on their caller ID. And you, as a health professional or anybody else that might be on this call that is referring somebody in, just please let them know that what the 855-462-5465 is what's going to show up on their phones when we do return those phone calls.
Well, I mean, if there are no other questions, we can give you back a few minutes of your lunch hour. And again, there's the contact information if you wish to inquire about services, or you can email Jackie with the information she provided. I want to thank everybody for taking time to attend this webinar. And I guess that's it for today.